Hi, my name is Shannon Sbroglia, and I'm doing my paper on the ethical and separately the legal limitations and restrictions on business organizations not accommodating maternity in the workplace, such as by not having designated rooms for nursing mothers to pump and not providing for paid maternity leave. So to begin, in doing my research, I read multiple law reviews, journal articles, and articles from the internet, but I also interviewed an HR analyst from a marketing company in Detroit, and I also interviewed an HR associate from a company in Mexico. And I won't get too much into that interview from Mexico for this presentation since that deals mostly with the legal aspect of my paper. But what I will say is that it was very interesting to talk to somebody who worked for a company in a country where that country mandated paid maternity leave. For those of you who don't know, the United States is one of the only industrialized nations that does not offer any sort of paid maternity leave. And to kind of put that into perspective, the worldwide average of paid maternity leave is 5 to 6 months. There's a visual in the handout that goes along with this presentation that shows the average weeks in different countries of paid maternity leave around the world, and then the United States having nothing. So it kind of goes without saying that even though the government doesn't mandate paid maternity leave, companies can choose to put together some sort of a benefit package where they do fund paid maternity leave. And there are some companies that do. Netflix offers up to 52 weeks of paid leave. There's some tech companies like Microsoft that offers up to 5 months of paid leave. But the vast majority of countries in the United States don't have a fully funded paid maternity leave package. The HR associate that I interviewed from Detroit said that their company follows the FMLA Act, the Family Medical Leave Act, which essentially is just 12 weeks of job protected coverage. So there's not necessarily, it's not necessarily funded. They get 1 week of 100% pay and then 5 to 7 weeks of 60% of their pay, depending on what kind of a labor and delivery experience they have. And then from that point, it's just the rest of it is unpaid. So the first issue with lack of paid leave is kind of obvious, but it's the mental and physical recuperation period. It's only ethical to give your employees the time that they need to be able to fully recover from how difficult of an experience labor and delivery is. And for some, it could even be a traumatic experience, and it can kind of wreak havoc and cause them to have some mental stability as well. But if many mothers are required to come back after 6 weeks, that's generally not enough time for women to feel fully healed and fully capable of tackling work. So the underlying theme that I touch on in my paper, and I'll mention in this presentation as well, that goes along with this topic is a lack of moral sensitivity. It seems that if the decision makers in these companies that are choosing to not pay for maternity leave truly understood the moral dilemma that they were putting on their employees, they wouldn't be doing so. I mean, childbirth is an extremely difficult and sometimes traumatic experience. It's very exhausting. It's, you're trying to get into the swing of things once you get back home. And so I don't think that the decision makers are really understanding that they're dealing with a moral issue. And if they were morally sensitive, then maybe they probably wouldn't be pushing forward in these packages that are just protecting their jobs for employees, but they're not funding them. So furthermore on that, we get into sustainment of breastfeeding. Sustainment of breastfeeding is positively correlated with the length of maternity leave. Women who returned to work after 13 weeks of maternity leave had a higher chance of continuing to breastfeed than women who returned to work between 1 and 6 weeks. Women who return to work between 1 and 6 weeks are probably 9 times out of 10 doing so because they have to. Because they can't live without money. They need to get back into the swing of things to collect a paycheck. And so the issue with that is once women do go back to work, if they have to go earlier than they should, a lot of women cannot sustain breastfeeding once they get back to work. It's too difficult. There's multiple reasons why it might not work. They may not have had enough time to bond with their baby and get a routine down. And the issue with that is that breastfeeding produces a lot of benefits for both the mother and the baby. In the handout that goes along with this presentation, there's a list of benefits for both mother and baby, but to name a few, babies that are breastfed have a reduced risk of sudden infant death syndrome, or SIDS. They have less chance of getting diabetes, of getting respiratory tract infections. And on the mother side, breastfeeding helps lowering the chance of women experiencing postpartum depression, postpartum anxiety, and it also can even reduce the risk of them getting ovarian cancer. So obviously, from an ethical standpoint, a company cannot stand between the benefits of breastfeeding and what it does for a mother and baby, because they don't want to pay their employees and they want them to come back to work. It's not ethical to cut down on the benefits of employee and baby just for the sake of not paying out some funded leave. So also along those same lines, a clean and accessible pump room is something that is necessary for women to experience and to use once they do choose to come back to work. The American Academy of Pediatrics recommends that infants be exclusively breastfed for the first 6 months of their lives. Obviously, from what we just talked about, women in the United States are returning to work before their babies are 6 months. So there needs to be accommodations set up that will allow them to continue to breastfeed when they're away from their babies. The marketing associate that I talked to in Detroit said that they do have a pump room, but it's also a shared prayer room. There's no refrigerator in there to store expressed milk, and it doesn't have the appearance that it's cleaned very often. So the issue with that is, even though there may be a room, it's not something that women are very comfortable using. And so many women may choose to just stop breastfeeding once they return to work because conditions aren't really favorable for them to do so. And so I believe in situations like this that the lack of a clean pump room could be the result of cognitive dissonance in the decision makers, in that they obviously believe it's important to have a pump room. They took the steps to get there, and so in their mind they think that it's the right thing to do, but there's no follow through on their end, and they're not following through on their actions, so what they're doing doesn't match what they think they should be doing, and that's something that needs to be remedied. So if all of that I just mentioned isn't moral motivation enough for companies to do the right thing, they should also recognize that supporting mothers benefits the company as well. If mothers are coming to work after they've recouped, they're mentally prepared, they're physically prepared, they're going to be a lot more efficient and a lot more productive than they would be if they haven't had enough time to heal. Also, having a lower risk of postpartum depression, postpartum anxiety makes women more excited to be at work, coming up with new ideas, and it also can cut back on medical benefits that the company would have to pay out if the women decided that they need to go and seek some help for these issues. So clearly, accommodating maternity in the workplace is benefiting everybody, and if in the end companies can recognize that their magnitude of consequences that their leave policies and accommodations have on their employees is high, then this can benefit everybody if they all work together to figure out the best sort of paid maternity leave package and the best sort of accommodations for maternity. So when analyzing why and how companies should accommodate maternity, you can kind of look at it from two different angles. There's the virtue ethics angle, where it obviously makes sense that a virtuous person would recognize that accommodating maternity is just the right thing to do. Yes, the government doesn't mandate paid maternity leave, but it doesn't mean that these companies can't offer their own package. That's what a person in a right moral state would think is the right thing to do. You can also look at it from a utilitarian perspective, where accommodating maternity results in a net benefit for the greater good. Like I just mentioned, it benefits women, it benefits the babies, it benefits the company. So accommodating maternity is really providing the best benefit for everybody that's involved. So in conclusion, there are many ethical limitations to not accommodating maternity in the workplace. I mentioned mostly in this presentation the lack of paid leave and the lack of not having great accommodations once women do return to work. And so it's crucial for companies to be more morally sensitive on this topic and to realize that they have a serious impact in the health and in the benefits of mother and baby, and in promoting a stable and supportive work environment. So there should be no question that a company cannot deem themselves as ethical unless they choose to accommodate maternity. Thank you.